Hi, this is Dr. Kimberley Linert, and you're listening to Incredible Life Creator Podcast. My guest today is Chris Riedel. Chris Riedel ran a highly regarded Northern California lab testing company, Hunter Labs, until falling to the nefarious scheme of the Blood Brothers, Quest and LabCorp, the world's top medical test labs. Their scheme, which involved loss leader pricing to doctors to gain their business, and then overcharging Medicare, Medicaid, and Medi-Cal as much as 40-fold, has cost taxpayers billions of dollars during the past 15 years and forced higher quality but smaller labs like Hunter either to fold or be absorbed by them. In his book, Blood Money, Chris exposes the underworld of medical fraud in unsparing terms. He begins with the Blood Brothers fraud against Hunter Labs and others, which pushed Chris and his attorney partners, Neal McCarthy, son of former California Lieutenant Governor Leo McCarthy, and Justin Berger, into action. Chris and his attorneys blew the whistle and won a landmark $300 million in settlements for the state of California and taxpayers in a highly publicized 2011 case. Welcome to the podcast, Chris.
Good afternoon. It's very nice to be here, Kimberly.
Yes, and I'd like to hear all about this because, wow, you took on two giants.
I sure did. And if my wife had known at the time that whistleblowers' lives tend to be utterly destroyed when these big companies learn who the whistleblower is, she would never have let me do it.
Yes. So let's just start out before you started the whistleblowing, because I think you were doing something else. So tell me about your life before this and how you started out and what area you came from.
Sure. I started at a very young age, two medical device companies. These companies developed a better method for identifying if you have a bacterial infection, what the cause of it was, E. coli, streptococcus, staphylococcus, and more importantly, which antibiotic would be most effective at which dosing. So you could use a smaller dose of a very toxic antibiotic and preferably just use a non-toxic drug. It gave a physician far greater latitude. And that system has saved hundreds of thousands of lives around the world. I went from there to starting a routine clinical laboratory like Quest and LabCorp, and we took it public in 1992 and 1991. I'm sorry. Following year, it was named the 40th best small company in America by Forbes.
Congratulations!
And I had the good sense to retire, and I stayed retired for 10 years. And Quest then bought in 2003 the last remaining local laboratory in Northern California. And my wife and my brother-in-law said, Chris, we have to get back into the lab. There's no place doctors can go for high quality service. And so we did. And we built this beautiful laboratory. We had 150 employees, state-of-the-art equipment. We were very proud of it. But after 2 years, my sales force began to come to me and say, Chris, doctors hate Quest and LabCorp services. They just hate them. And they love our services. But Quest and LabCorp give them these very cheap prices for a small portion of the business that's billed directly to the doctor. And these companies do this so that they can hook the doctor as a client. Doctors don't want to have to figure out with the patient, well, he's going to go to Medicare in this lab and he's going to go to Blue Cross in this lab. So they get them with these cheap prices, and then the pull through Medicare, Medicaid, and insurance business is where they make their money. And so it became clear, unless we were going to match these prices, doctors were not going to switch, no matter how much they hated the services of Quest and LabCorp. So I called my regulatory counsel and said, if I try to compete with this, will I have any regulatory liability? And my attorney said, oh, absolutely. First of all, their entire business model is a gigantic kickback scheme. Sell below cost to pull through profitable business. But even more importantly, and directly in California, California Medicaid program, Medi-Cal, is entitled to the lowest charge that these labs charge anybody. So for example, the fee schedule for the most common test ordered, a CBC, was over $8. Quest charged some of their more favored clients $1.43. So they were ripping off, I mean, they were billing California $40. California paid the $8, so they were ripping California off manyfold for the most common test. And at that point, I had a decision to make. Was I going to knowingly violate federal and state law and attempt to compete with these blood brothers? Was I going to lay off 150 great employees, shut the doors, and wipe out most of our net worth? Or was I going to try and do something to stop the fraud on taxpayers and level the playing field for all labs in California? That was my choice. It took me 4 months to convince Marcia, my wife, who was also the president of the lab, to go forth and file a whistleblower lawsuit against these companies. But she told me, Chris, if this ever comes back to harm our children, I will never forgive you. You talk about pressure.
Yeah, that is pressure. That is pressure.
So that's how I got into it.
Yeah. And so what does filing a whistleblower case entail?
You have to develop evidence. I mean, emails, fee schedules, internal company documents, testimony. You have to develop strong evidence that either a kickback is being offered, or they're not billing correctly, or they're doing other nefarious things. And if you get that evidence, then your lawyers will file what's called the whistleblower lawsuit, and it's immediately sealed by a judge. Nobody knows it's out there. And it goes to either the Attorney General's office if it's a state case, or in a federal case, it goes to the Department of Justice. And then they spend years deciding whether or not the case has merit in their eyes. And if they think it does, they unseal it, serve it on the defendants, and then they do very active discovery. But the statute was designed as a public-private partnership so that we would work together with prosecutors. Unfortunately, the Department of Justice hates that idea and doesn't do it. And most of the state AGs, they didn't do it either. But in the few cases where they did, we had tremendous success. And so that's one of the frustrations I learned about becoming a whistleblower.
Mm-hmm. And as you know, a small lab with probably limited resources compared to these two giants, how were you able to get the initial information you needed to actually start this process?
That's one of my favorite stories in my book, Blood Money, which is an Amazon bestseller. I had to become a detective. I had no detective skills. I was a CEO. So I had to learn how to be able to call people up out of the blue, win their confidence, and get them to talk to me or give me documents. And I found that to be incredibly rewarding. Mm-hmm. Probably in another life, I should be a detective, private investigator. But that's what it takes. It's not easy. But if you're going to succeed, you have to have the evidence.
Mm-hmm. And I'm just curious, after all this went through, you know, the doctors had these, you know, they weren't paying very much for their lab tests. So all this goes through and all this is revealed. What was the reaction of the doctors? Were they surprised? Were they upset because now probably their lab test prices would go up?
Well, they knew this wasn't kosher. But as long as these big giants, you know, who had hundreds of attorneys working in their regulatory compliance department, were willing to offer the discounts, they were going to take them.
Mm-hmm. Yeah, because they weren't doing anything illegal by taking them, right?
Well,
Because
they were receiving kickbacks. They
oh, they
absolutely
were.
were doing something illegal. But
Oh,
the government doesn't like to go after the recipients of kickbacks, the doctors. It's very rare where they are prosecuted. There was one U.S. attorney, assistant U.S. attorney in New Jersey, who did on the same facts and evidence that we presented, and something like 30 doctors went to prison. Yeah,
wow.
serious stuff. But that's the only time I've ever seen the government go after the recipients of the kick. Well, I take that back. In another case, a federal case, uh, we won a $119 million verdict at trial. And the company and all the bad guys immediately declared bankruptcy. So the bankruptcy attorney said, ah, and he starts suing all the doctors for the amount of the kickbacks they got.
Oh, wow. They really,
Can
they
you
found a
imagine the
way.
shock on these doctors when they got these, $20, $30, $40,000 bills for payments over time? But that was the bankruptcy trustee. That was not the government. Why the government didn't do that, I don't know.
Mhm. Right, because it's basically the taxpayers' money and the government's money. I mean,
Our money.
our money. Yeah.
We are being fleeced by healthcare fraud in this country, which is massive. The FBI estimates that 1 out of every 4 healthcare dollars is lost to Medicare fraud or to fraud in healthcare. 1 out of every 4. That's $250 billion a year. If we didn't have that, everybody's health costs would go down 25%. Now, that's a lot
That'd
of
be
money.
awesome. That would be wonderful if our health
All,
went down
all,
25%.
all Department of Justice has to do is make it clear to these fraudsters that it doesn't pay. Because right now it does. But if they start throwing people in prison and making and pay back all the monies they got, stop like that.
Mhm.
But the Department of Justice is more focused on, quote, affordable civil settlements. So if they catch somebody, they generally will settle for 20 to 30 cents on the dollar, allowing the fraudsters to keep the remainder. They don't seem to be after justice.
Mhm. So as a consumer or someone who is going to go in and get taken care of by the doctor, is there any control I have as a consumer to know, if my doctor is honest or if he's not, or if he's, do I have any control over that, or is there any education I should have?
Unfortunately, no. It's the backroom billing is so complicated. You know, Patient gets an explanation of benefits, and it shows what was charged, what the insurance company paid, and what their obligation is. But the fellow who orders the test, generally the doctor, he doesn't see this, and he wouldn't know what the billing codes are anyway. So it's very hard. It takes an insider, somebody within the industry like me, to unravel this, which is one of the reasons when these prosecutors choose not to work with the insider, they don't go anywhere. They don't know what they're doing.
Mhm. So these doctors who went to prison, is a possibility that they didn't even know what was going on because the billing people were actually doing the billing. And
Well, except for the fact that they were handed envelopes full of cash every month.
oh, tell me more about that.
Yeah, one would think that when you start getting envelopes filled with cash, which was a common practice for many of these fraudsters, you would figure it out. Something's wrong here.
Oh,
You
now we're
don't have
getting
to
to the
declare
bottom
it
of the
on your
story.
income taxes. The company's not declaring it. Well, I don't know if they're declaring it as a loss or expense or not, but what we did learn through testimony was that when the doctors started getting envelopes of cash, they ordered one heck of a lot more tests.
Ah, and again, tests that we as consumers don't need. And
That's another big problem. One of the things that some of these fraudsters did is, for example, in cardiovascular disease, uh, there's probably a dozen tests that are really important, many of them new tests. But a couple of these companies would charge the government 70 for 70 or 80 tests. Ridiculous. But because they were paying the doctor money every month for every order, and because they'd agreed never to bill for a copay or deductible, nobody knew. So if you see a large battery of tests, ask your doctor, what are all these tests for? And look at your EOB. If you're not being charged much, there's a fraud going on.
Wow.
And again, EOB is your explanation of benefits from your insurance company.
Mm-hmm. Yeah, thanks for clarifying that. So
I didn't even know how to read one until I got into this. I was in the industry.
Yeah, well, I'm a behavioral optometrist, so I stay as far away from the billing as possible because that insurance billing is just really complicated and
The
difficult to
latest
understand.
scams now,
Mhm.
the government is highly lasered in on insurance companies with the Medicare Advantage program. The way that works is it's like they receive a fixed fee per month for treating patients for all their healthcare.
Mhm.
But if they can identify that the patient has diabetes or heart disease or some other things, their reimbursement goes up as much as 30 to 40%. So guess what they do? They fake it,
They say you have diabetes when you don't.
right? They fake it. They go back and they put in diagnosis codes that the doctor didn't give, and it's called upcoding. And the government has now a sting operation against these huge healthcare companies that we all know. In fact, Aetna and Blue Cross were just in the news today that there's a gigantic investigation for exactly that.
So
Well, it's not limited just to the doctors and the companies. The insurance companies in on it too.
Mhm. So I'm one of those people, I want to go in and fix things. How do we fix this? How do we get everything running smoothly the way it's supposed to be so that people are honest and we go in and we pay for the tests that we are taking and the insurance companies are paying for the tests that are being done at the rate they're supposed to be paid at? How does this get fixed?
There's only one way, Kimberly. Uh, right now, and for many, many years into the past, it pays so well to cheat. The odds of being caught are minimal. And if you are caught, we're going to slap you on the wrist and you'll keep 70 to 80% of what you stole. There are companies like Quest Diagnostics, they've had 10 settlements over the years. No one lost their job. No one lost the bonus upon which the bonus was achieved for the fraud. And so until the Department of Justice gets serious and puts people in jail and punishes them, it's going to continue. Now, how do we get the Department of Justice to do its job? I have no idea. One of the reasons I wrote Blood Money was to alert Congress and people and the Department of Justice about what's going on. And I think it's only going to be through somebody senior in the administration or Congress, because it's not the leaders of DOJ that are involved. It's the career civil servants who've been there forever and can't be fired.
Mm.
That's their view. I mean, explain to me why, for example, we file a whistleblower lawsuit and we hear, oh, we're very busy, we'll get back to you, and it takes 3 years. The statute was designed such that we'll do all the work. You oversee it. We'll write the motions. We'll go through the documents. We'll do the discovery. They're getting free, very good experienced lawyers. Great.
Mhm.
They don't want to do that. Why?
Well, is there a payoff somewhere else along the line? That's my question.
I don't know, but I know that I have been treated by certain people from the Department of Justice as if I were the bad guy for bringing this to their attention.
That doesn't even make sense.
So you tell me, Kimberly, if you have any idea how to change the behavior of the Department of Justice. I don't know what the pressure point is. Now, I will say this, Kamala Harris, our vice president, is a very close personal friend of Neil McCarthy, my attorney. And I'm hoping Neil and I will go visit her with some senior Department of Justice people and lay out all the facts that we have.
Mm-hmm.
And she'll do something. That's the only hope I have.
Mm-hmm. Yeah, you would think that, California and the other states losing that much money, they would be concerned about trying to get some of that money back.
Yep. Well, I mean, this book is filled with unbelievable stories. As an example, we won $300 million in California. And shortly after we won it, we got a phone call from the Assistant Attorney General, one of them in New York, saying, when are we going to get our money? And we reminded him that we had filed the exact lawsuit against the exact defendants on the same facts and the same law in 2008. And 2 years later, we got a call from an assistant AG saying, well, they're clearly breaking the law, but the department thinks it's bad public policy. So we're going to ignore it.
Wow,
how do you deal with that?
I don't know. That is really wild.
And the fix was definitely in on occasion. The former governor of Florida, Rick Scott, who's now chairman of the Republican Party, torpedoed his own attorney general's case.
So now that you've written the book and you're making people aware, and you've been doing these activities where you're actually blowing the whistle on these things, what's next for you?
Well, I'm doing a lot of these. I get calls from people who say, Chris, I read about you, and you've certainly done a heck of a job. My company's doing this or that, or a competitor is doing this or that. What do you think? And if they convince me that, yes, it is a fraud and they can get the evidence, then I form a partnership with them and, an LLC. And then I take it to my lawyers and we file another whistleblower lawsuit. And we just filed one. It's $1 billion damage claim, $1 billion against a major healthcare company. I can't talk about it because it's under seal.
Mm-hmm. Exactly.
So that's how I spend my days these days. And I enjoy it.
Mm-hmm. So just a different kind of question. So how important is justice for you? As you were growing up, were you the person who always wanted things to be fair?
Kimberly, yes. And maybe I'm just an unusual guy. But being ethical and operating ethically to me it's in my nature. Mm-hmm. The book has stories of some of the horrible things that cost patients lives that Quest and LabCorp did. I could never do those things. As one example, we have a picture in the book of this attractive young woman in her early 30s with her 2 young children. LabCorp misdiagnosed a Pap smear, which is used to detect cervical cancer. If it had been detected, her life would have been saved. And then we have another picture of her on her deathbed with her 2 young kids. And a jury found LabCorp was negligent. And then I learned that both companies, both Quest and LabCorp, allocate $3 of every dollar of revenue from a Pap smear, which is only $20, for legal. In my entire career, we've never had anybody accuse us of having a bad lab result.
Mm-hmm. So it's all about integrity.
Yeah.
It's all about integrity. Yeah. So if people wanted to contact you or work with you, how would they contact you?
chrisriedelauthor.com
Mhm.
is my website,
Mhm.
and all of my contact information is on there, and a lot of the description of some of the stories in the book as well.
Beautiful. So just a personal question. What gives you the most happiness and fulfillment in your life at this point?
My family.
Mhm.
We all, when the bad guys attacked us, Quest and LabCorp, we were 2 weeks away from both personal and business bankruptcy. And I couldn't function. My wife fortunately stepped in and managed the cash flow, so we kept the doors open. And so I almost lost my family, almost lost my life. And I now realize that family is so important. And in business, you tend to get consumed. Take time for your family.
Mhm. Yeah. Yeah. Family's just the most important.
No matter how much your kids criticize you, they love you.
Yes. Yes. So you have kids? Do you have grandkids?
Nope, we have 4 boys, no grandkids, unfortunately.
Mhm. There's always hope. There's always hope.
Oh, we are hoping, yeah.
Yes. Yes. So one last question before we finish. What is your best advice on living an incredible, amazing life?
Um, Follow your heart, follow your passion. If what you're doing, you're passionate about, it's not work.
Mhm.
And don't give up. All entrepreneurs, that's my advice to them, having founded 5 companies.
Mhm.
Problems are obstacles to be overcome. Do your best to find a way to overcome it.
Beautiful. Well, thank you so much, Chris. And we'll talk to you again soon.
Thank you, Kimberly.